Dizziness is a common occurrence and it is defined by many names by people. Some people will talk about being off balance, some will talk of being weak, some people will talk of syncope, or some people will call it vertigo. There are usually four categories of dizziness, which could be the first one, which is vertigo, whereby you feel like the world around you is spinning, or the room in which you are or the place you are is spinning around you. It's usually from diseases that affect the ear, especially the middle ear, which is the part of the body that is concerned with balance. Then we have presyncope dizziness, which is a swinging feeling. Usually this could be from conditions that affect the heart and the blood system. And then we have disequilibrium, which is being unsteady, and it is usually caused by the problem that could be affecting the brain. And then we have non-specific dizziness or giddiness or jitteriness, which is usually non-specific and could be caused by many things. Usually we start with the vertigo, where you feel that the world around you is spinning, and it can last for seconds to minutes, and they even can persist for hours. Usually it is caused by problems that affect the inner ears, which include things like infections of the middle ear, and then we also have sometimes a disease we call Meniere's disease, whereby there is ringing in the ear due to accumulation of fluid in the middle ear. And then we have a condition that we call benign paroxysmal movements, which is caused by accumulation of calcium crystals in the middle ear. Then we have lightheadedness or presyncope, which is a temporary lack of blood supply to the brain, and it can be caused by fainting, can be caused by heart problem, especially dehydration, extraneous exercise. Some medications, especially the ones that are used for blood pressure control, can cause this. If you have some neurological problem, and then we have problems with the rhythm in the heart. Then we have problems that cause loss of balance. This is usually caused by problems in the brain, especially the lower part of the brain, and this could be due to growth in the head, could be a stroke, or could be infections of the brain. Some drugs can also cause this, and they also could be a reaction to drugs, and also alcohol. So we also have conditions that affect the heart and can cause persistent dizziness, like problems with your heart rhythm. So when you have persistent dizziness which is not going away, then it is usually good to have you evaluated by the doctor. And when the doctor will examine you, we want to know when the dizziness occurs and what are the other associated symptoms like headache, vomiting, if you are using any medication for any condition, and also if you have been engaged in exercises. Your nutritional program also might help, because sometimes excessive thirst or excessive hunger can also cause dizziness. Then some of the blood tests would be included doing a hemogram to see what is the level of your blood count and what is the level of your HB. And also you may, if the doctor thinks that your dizziness could be caused by a heart problem, then it would be good to do what we call an ECG or an electrocardiogram to check how your heart rhythm is. If you could be having problems that are coming from the brain, then it would be good to do a head CT scan or a brain MRI to rule out the possibility of a stroke, or to rule out the possibility of having a growth in the head. So the treatment depends mainly on the main cause. If you have ear infections, most of them will be self-limiting and they will go away. Some of them are bacterial, but most of them go on their own. You could have viral infection. Of course, if you are exercising, then it is good to be sure that you are well hydrated and you are taking adequate calories to cope up with your exercises, and then avoiding activities that could endanger your life. If you're having dizziness, like driving, swimming, and also sometimes just change of position, like if you have been studying for long, just lying down could help. And if your dizziness comes when you wake up and start, then waking up or in stages could help, like you sit down for a few minutes and then you stand, and this could be helpful. Then I've talked about taking plenty of fluids, avoiding some drugs, and if you are taking some medication like for hypertension and you have persistent dizziness, then it would be good to see your health provider so that you can see whether she needs to modify your drugs. Then of course avoiding excessive intake of alcohol, that would be helpful. And so those are some of the things that could be causing dizziness, and those are some of the things that you can do to be able to remedy the happenings of dizziness. Thank you for watching. I would encourage you to subscribe to our channel for more videos and also for more enlightenment. Thank you very much.